1. Which of the following best describes the primary role of a certified prevention specialist, CPS? A. To diagnose and treat substance use disorders. B. To implement and evaluate programs that prevent substance misuse and promote wellness. C. To manage mental health treatment centers. D. To enforce laws related to controlled substances. 2. In program evaluation, which type of evaluation focuses on determining if program goals were achieved? Process evaluation. Outcome evaluation. C. Formative evaluation. D. Needs assessment. 3. When developing a prevention curriculum, which learning principle ensures adults apply new knowledge to real-life experiences? Abstract reasoning. B. Experiential learning. C. Passive observation. D. Lecture-based learning. 4. Which federal agency primarily supports substance abuse prevention efforts through grants and education? A. Centers for Medicare and Medicaid Services, CMS. B. Occupational Safety and Health Administration, OSHA. C. Substance Abuse and Mental Health Services Administration, SAMHSA. D. Centers for Disease Control and Prevention, CDC. 5. A CPS mentoring a new prevention worker should primarily focus on A. Assigning independent projects immediately. B. Modeling effective communication and ethical standards. C. Minimizing feedback to promote independence. D. Prioritizing administrative tasks over fieldwork. 6. In community prevention planning, which step comes immediately after conducting a needs assessment? A. Developing the budget plan. B. Selecting evidence-based strategies. C. Writing funding proposals. D. Conducting process evaluation. 7. The best method to evaluate participants' learning during a prevention training is A. Group discussion only. B. Written feedback from participants. C. Pre- and post-tests measuring knowledge gain. D. Observing attendance patterns. 8. Which prevention strategy focuses on enhancing individuals' resilience and coping skills before a problem begins? A. Universal prevention. B. Indicated prevention. C. Selective prevention. D. Remedial prevention. 9. In program planning, using data from community surveys to identify risk factors represents which core prevention competency? A. Ation. B. Needs assessment. C. Program management. D. Mentoring. 10. When training adult learners, the facilitator should A. Deliver long lectures without interaction. B. Encourage learner participation and discussion. C. Focus only on theory without application. D. Avoid questioning learners to maintain authority. 11. Which of the following represents a measurable prevention program objective? A. Improve community health awareness. B. Reduce underage drinking by 10% within 12 months. C. Support youth well-being initiatives. D. Increase community collaboration. 12. A CPS reviewing fidelity of an intervention is checking A. Whether program activities match the intended design. B. Whether participants are satisfied with the program. C. The financial efficiency of the project. D. The diversity of staff members. 13. Communication in prevention programs should be A. One-way and authoritative. B. Clear, culturally sensitive, and audience appropriate. C. Focused only on data dissemination. D. Limited to professional stakeholders. 14. Which mentoring approach best supports long-term professional development? A. Directive with little flexibility. B. Coaching that encourages reflection and goal setting. C. Sporadic advice without structure. D. Critique-based with minimal feedback. A CPS implementing a school-based program must first ensure A. Parental and administrative consent is obtained. B. The curriculum is entertaining. C. Teachers are available to observe sessions. D. Students can attend voluntarily. 16. Which of the following is an example of formative evaluation? A. Conducting mid-program feedback sessions to improve delivery. B. Measuring overall reduction in drug use after completion. C. Comparing two programs' long-term outcomes. D. Analyzing budget efficiency post-program. 17. Which document outlines professional and ethical guidelines for prevention specialists? A. The National Prevention Strategy. B. The International Code of Conduct for Prevention Professionals. C. The U.S. Constitution. D. The Federal Register of Substance Use Policies. 18. When a CPS tailors prevention messages to specific cultural groups, they are applying which concept? Cultural competence. Educational bias. C. Standardized programming. D. Universal prevention. 19. In adult learning, which strategy increases retention and engagement? A. Providing hands-on activities and problem-solving tasks. B. Memorization of facts through repetition. C. Passive video lectures. D. High-pressure testing environments. 20. Which prevention model emphasizes strengthening protective factors and reducing risk factors? A. Risk and protective factor model. B. Disease control model. C. Clinical recovery model. D. Social health model. A CPS notices data inconsistencies in evaluation reports. The correct action is to A. Ignore the discrepancy to maintain schedule. B. Verify data accuracy and document corrections transparently. C. Blame data collectors for errors. D. Submit the report as is. 22. When evaluating program impact, which metric best measures behavioral change? A. Number of flyers distributed. B. Pre- and post-surveys on attitudes and behaviors. C. Attendance rates. D. Budget utilization reports. 23. The principle of do no harm aligns with which ethical standard? A. Beneficent. B. Justice. C. D. Accountability. 24. A CPS designing an intervention for high-risk youth should A. Base it on evidence-based prevention practices. B. Design activities without reference materials. C. Focus only on entertainment value. D. Skip evaluation to save resources. 25. In mentoring, active listening involves A. Giving advice before hearing all details. B. Focusing entirely on the mentee's message without interruption. C. Planning responses while the mentee talks. D. Dominating the conversation. 26. Effective curriculum development for prevention includes A. Setting clear objectives and aligning content with outcomes. B. Minimizing assessments to save time. C. Avoiding feedback loops. D. Excluding community input. 27. Which regulation ensures the ethical handling of research participants in prevention studies? A. Health Insurance Portability and Accountability Act, HIPAA. B. The Belmont Report Principles. C. OSHA Standards. D. Clean Air Act. 28. A CPS demonstrates accountability when they A. Blame partners for project delays. B. Take responsibility for outcomes and actions. C. Avoid documentation for efficiency. D. Focus only on successful reports. 29. The first step in effective communication planning is to A. Identify the target audience and their needs. Develop key messages before knowing the audience. C. Select communication channels randomly. D. Send information without testing clarity. 30. Which prevention approach targets individuals at highest risk of substance misuse? A. Universal prevention. B. Selective prevention. C. Indicated prevention. D. Secondary prevention. 31. When collecting evaluation data, confidentiality means A. Sharing information only with authorized individuals. B. Posting participant data online for transparency. C. Discussing cases openly among staff. D. Reporting all data to the media. To improve team collaboration, a CPS should A. Promote open dialogue and shared decision making. B. Avoid discussing team goals. C. Assign roles without explanation. D. Focus only on top-down communication. 33. During training, using case studies primarily helps develop critical thinking and problem-solving skills. Memorize facts quickly. C. Reduce interaction among learners. D. Test memory retention only. 34. Which of the following is not a primary prevention domain? A. Community-based prevention. B. Workplace prevention. C. Correctional rehabilitation programs. D. School-based prevention. 35. A CPS ensures compliance with funding requirements by A. Documenting program activities and financial expenditures accurately. B. Submitting partial data to meet deadlines. C. Estimating results without verification. D. Skipping reports for short-term projects. 36. When adult learners resist participation, the trainer should A. Explore barriers and adjust teaching methods. B. Continue without addressing the issue. C. Increase lecture duration. D. Reduce engagement opportunities. 37. The main purpose of data-driven decision-making in prevention is to A. Base strategies on measurable evidence rather than assumptions. B. Replace human judgment entirely. C. Focus on aesthetics of reports. D. Avoid community involvement. 38. The key to maintaining cultural humility is A. Recognizing one's biases and continually seeking understanding. B. Assuming all cultures are similar. C. Avoiding discussions about diversity. D. Prioritizing one's cultural norms.